Oh my, there's so much to tell you about Ars Literarium. Let's talk about its origins, the beginning. And that happened to be a first-year medical student walked into the Humanism Center one day, and she said, Miss Norman, she said, we're missing a literary magazine in our medical school, and we need a space where we can write, be creative, submit works of art that everyone can share. She really, really felt that, the narrative medicine, the literary, the humanities should be included in New Jersey Medical School for our students.
It's really interesting. So we always kind of thought about art therapy as being very helpful. Even since the 1940s, we know that it's been very helpful for mental health and has improved various conditions from depression and anxiety. I think more recently now there's a new field actually of neuroaesthetics. So in the 1990s, this field came about. It's sort of the study of how art measurably changes our body, brain, and even behavior. And what researchers have found is that even 20 minutes of either making or beholding art can change the brain. So it's incredible how much the neuroplasticity of our brain actually responds to art. So I think just the fact that when you engage in art, it can improve, stress, decrease cortisol, improve serotonin levels, and even actually help with thinking about, dealing with trauma or traumatic experiences, which can sometimes happen, of course, in the healthcare environment, is really, really valuable and important.
The various art forms that are included in Ars Literarium, they can really vary. We get pieces that are 2D, 3D, and the mediums also vary. There's watercolor, there's acrylic. You'd be really surprised by seeing all the different mediums that people can use and work within their free time. We also get from the dental school specifically, sometimes we get their teeth models and people who crochet in their free time. We really get everything. We've gotten poetry, we've gotten stories, things that people have seen in the hospital, kind of micro encounters with their patients or moments they've had in the hospital or outside of the hospital. So writing and art.
The literary magazine has just so much potential to heal. And it's a way for people to express feelings that they may not be able to express in other ways. For example, sometimes when we have students rotate through, say, a trauma center experience or an intensive care experience where a lot of things happen very quickly, there may not be time or space for them to express the impacts of that experience. And the literary magazine allows them to do so in a way that just opens whatever doors they have. So it doesn't have to be, what did you think about that? Or, that must have been difficult. And those are important conversations. But for some people, it may be important just to capture it in a drawing or capture it in a poem or express themselves in an essay. And it may not even be their personal feelings. It may be what they perceive the patient or somebody else in the situation was feeling and how that impacted on them. And so there's so many opportunities to allow people to share this experience, whether it's theirs or what they have believed to be the experience of others in the room, in a way that other people can then participate in that experience. So it really serves as a tremendously powerful outlet to discuss your thoughts, to just express your thoughts, and to have other people share your thoughts.